wrapping everything, we'll cover with a bath blanket. Sometimes you'll find these in the hospital, sometimes you won't find them. During checkups, you guys will be practicing or doing it with a mannequin or maybe another student in the bed, and you will be working together. So one of you will be on one side like Kristen is, and one will be on the other side like I am.
And it's nice to do this with, like I said in the lecture, with a friend if you have the time and a person that is free, or your tech, because if someone is bedridden, it's a lot easier to move them over with a partner. It might be impossible to do by yourself if they can't hold on to the rail or whatever to wash their back, that kind of thing. And it's just nice to establish rapport with your patient. This is such a kind of intimate thing to help someone do, and the gratitude you would get from them that, hey, someone is willing to help me in this manner. And you can learn all about them and again their assessment. You can also learn how their activity is. You may not have seen them get out of bed or even know if they can roll yet, and so it's a good time to be assessing that, their range of motion, their respiratory cardiac status. Believe it or not, there have been many patients that I've had that will not tolerate a bath for whatever reason. Like maybe their respiratory rate is 45, they have a fever, they cannot breathe on their own, so to turn them is a huge concern. And there have been times where, like, if we give them a bath right now, I don't know if they're gonna code or not because they are not doing well. They might be on their way to ICU. So it does take judgment knowing when is the right time to give a bath. So it sounds kind of dramatic, but not everyone can tolerate a bath and give themselves a bath. So like Instructor Fink said, privacy, you guys know that with your pre-procedure steps, but making sure the door is closed. Now they have the lights on the end or at the outside of the room to kind of know where nurses are, but if I'm gonna go give a bed bath or be somewhere for a significant amount of time, it's nice to communicate with your team. So if they're looking for you, a lot of times you just assume if the door's shut that the patient's in there by themselves, but baths can take a while. So
notice when I took this off how I kind of patted it and checked and stuff. It will at one point in time in your career, you're gonna find phones inside of here, you're gonna find dentures inside of here, you're gonna find hearing aids. Those are very, very expensive, so when you're taking off your linen, you always wanna check and make sure there's no hearing aids in there, no dentures or anything like that, okay? Dentures are over $1,000 to $2,000 for a set of dentures. So, and Medicare, Medicaid will not pay for those.
yeah, and they might not be able to eat without them, so then that's a problem if they're in the hospital for a while too. So, and I know I said this already, but if you didn't hear, please wear gloves when you're giving baths and changing them. I know I don't have them on, but that's what you do. So if you guys have watched the videos yet, you'll see, like she's doing, it's a lot of placement of different towels and using different towels, or if you're doing the bath in a bag, there are different washcloths or little towels in here to use on different parts of the body. So never know what kind of bacteria might be on the skin, or just for cleanliness, you don't want to just use like one washcloth and bathe their entire body. It's gross, dead skin cells, all that kind of stuff. So
The book does say like 8 to 10 washcloths.
I'm guessing we don't have that many.
No. Do not pull the 8 to 10 washcloths on the unit. Who is it works at? We've got a couple. How many washcloths do you pull? Cassie?
Probably like 5 or 6.
Yeah, but not 8 or 10.
Usually you'll kind of fill up that basin, throw your washcloths in, and water, chlorhexidine, whatever you're.
Okay, the book talks about, first off, when we start, face, and Professor Boss talked about that, when it said, do not use soap on the face. This is what we call the mitt. And how I did that was you take it like this, wrap it around your hand, bring it up, and put it in. This is the mitt. So when I'm doing the face, I'm going to start out water only, and I'm going to go for the inner cannula of the eye to the outer side. One swipe and turn this around to get another clean spot of it. And then I'm gonna do this side from the top out. A lot of times of a morning with your older patients and stuff, their eyes will be matted closed. And sometimes I've had to take a warm, get warm washcloths, 3 or 4, lay on their eyes, across until it kind of soaks off in order for them to open their eyes. You cannot scrub the eyes or anything like that. And again, remember, each time you go into that eye, it's going to be one swipe and then rotate your cloth around. And then one swipe up to the top, okay? So you don't use the same going back and forth because we don't want to cause an eye infection. And then you'll just wash the face, rinse everything with water only, and then just go up and wash the face and stroke from the inner to the outer. Gonna be doing behind the ears and stuff is real important, especially because if there are oxygen or anything like that, we don't want any skin breakdown. Come down to the neck. Again, changing your washcloth, rinsing as you go, and patting dry. The arms, you want to
Keep going, you got your mitt.
I got my mitt. The one thing that always gets, talking about the nails. If I wanted to, my patient's nails were really, really dirty, and a lot of stuff caked under, maybe she was picking at her scab or pulled out her IV and there would be blood underneath there. I can take and put a pillow underneath her arm here, kind of raise it up, drop her hand down into a warm basin, and let those nails soak for a little bit before I do the rest of the arms and stuff like that to help break all that debris out underneath there. One phalange at a time, go in between. You want to make sure and dry everything well. You're always going to start from the distal and go up to the proximal when you're doing your bath and stuff, and then go up into the axilla armpit to get everything clean. But the reason I'm doing it this way is I'm promoting the circulation, okay? The other thing when I'm doing a bath is a perfect time to check and do my range of motion if they need to have passive range of motion. But also I can be checking to see about any joint problems, issues, or anything like that. Everything is dried and patted dry, not rubbed. You notice I'm not rubbing anything.
And if there are any areas that are super red or broken down, you don't want to massage those areas and make them worse. You also want to make sure they don't have or that you suspect like a blood clot. You don't want to massage that, dislodge it, and it goes to their lungs and they die from that. So just be aware of your history physical exam. Or like for my oncology patients, if they've had lymph node removal surgery or active cancer, if they have to get an actual note from us usually to even go get a massage. So you don't want to be just massaging all of this lymph tissue around if you don't know your patient.
Do I want to just automatically put lotion on my patients? No. If they ask for it, they might have their own hand lotion or something like that. And again, like you were talking about the hand massage and stuff like that. It's nice, it's relaxing, and I usually do that a lot.
Yeah, I went to a new hair person and they did that for me and I was like, oh, this is nice.
Oh,
Didn't know I was paying for that. Yeah.
So you pat dry. Each of us will be doing the same thing. You guys will be doing the same thing when you're doing the checkoff for the bath. You're going to want to be talking, and then the other one to say, well, this is why we go from distal to proximal. And maybe the other person to say, and we want to make sure everything's dry. Make sure phalanges and everything's dry underneath. When you're doing the chest area. For the guys, a lot of times you can ask your female patients if they prefer to have another nurse come in to help with that or whatever. You know, and some women will say, oh no, you're fine, go ahead with this. I've got her all covered. We've done both arms and stuff. Now I'm going to the chest. I'm gonna take her gown and we're gonna just bring it down, keeping her covered, and bring it right like that, okay? So when I'm going underneath in here, I'm gonna keep her covered. I can keep this one on my hand. New washcloth. I'm gonna come in, I'm gonna be examining everything from this angle, washing the chest. When I go to get underneath the breast, I'm not gonna cup. I'm taking the back of my hand and lifting up and coming underneath to wash. Once I get everything washed, I'll take and dry, pat everything dry and stuff like that. I always ask the patient, does that feel dry enough? I can't tell.
Sure.
I mean, I just can't tell. Then you can come on down, do the abdomen. Again, everything's kept covered. This is the time you can put your clean gown on if you want, because we have everything done.
What about the legs? The legs?
I'm coming on down. It's a process.
Because you're wearing the gown, like the leg is dirty and you're putting the clean gown on.
Well, I'll show you how we do this, okay? So the gown or towel comes off. This would be kept up here. This comes on down. And we're keeping her covered. And we'll come on down and pull this off. Or pull it to the side. See how I'm doing that, tucking her in. I'm keeping more clothing on her because it's cold. When you're doing a bed bath for somebody, it gets very cold. So when you're doing the legs, it's gonna be the same thing.
Yeah, so same thing, you have your mitt and you are going same way for circulation again. Because they might not be getting out of bed at all, and so they're not having normal circulation and walking in the halls. And you might be the only one even offering them range of motion exercises. They may not have a PT order, they should, but they might not have people actually taking the time to do that. So, and we want to prevent blood clots, especially if they're in bed as well.
Not rubbing, and the long strokes up and down.
And here's where you can assess for edema. You can assess for breakdown on the heels especially. And then when I mentioned about diabetics that either can't feel or just don't look at their toes or in between their toes and on the bottom of their feet, or you might even have, you know, a pregnant patient that can't get to her feet. There's so many types of patients that can't assess certain things on their bodies. So.
Another way to soak the toes and the feet and stuff like that. Get a washcloth, real warm and everything, and you can just wrap it around, kind of tuck it in, and let that soak or sit on the foot for a while. Will really help clean and stuff like that. Patients love to have their feet wrapped and stuff, if, you know, because it makes it feel like they're getting their yeah, feet soaked and stuff like that. So we're gonna do, we have both legs done, everything's done. We're gonna do what the book calls the little diamond type thing. So you take and wrap this around your patient's foot. I'm gonna do it this way. Because now we're gonna go perineal here.
And this is something for your checkoff. I believe you just have to explain, correct? You don't actually do. And certainly if you're doing it with a partner. Yeah.
So when you have it like this provides the privacy. I'm gonna bring this out now.
Mannequin doesn't exactly move like a human.
I know. I'm gonna have my cart right here, my linen thing to drop it into the linen basket. Do not drop linen on the floor in the hospital setting. I don't want to see that as I'm going down the hall and seeing linen, and I have seen that. Do not ever take all of the clothing out of your patient and start the bath. I've walked in on students and the patient was stark naked. Not once, it happened twice. And I was like, I can't believe you keep doing that to your patient.
That's her.
She didn't last long. No, she preferred not to last long.
Yeah. It's cold. It's
I didn't start naked.
talk about the Franciscan values. It's not obviously what you're supposed to.
No curtains pulled, no privacy, nothing. Okay, so now I'm gonna come up into there and I will be explaining to my patient, I'm gonna be doing your perineal care. Special thing about perineal care, we don't repeat, again, it's similar to the eyes. You're gonna go from the area furthest away, stroke down. Change your washcloth. Close to you, stroke down. Change the washcloth. Then straight down the middle, down, from the top down. And then you'll dry and you'll be getting the thighs and stuff like that. But you notice how everything's still covered. So I'm providing her with the dignity and keeping her covered.
When you mean change the washcloth, you mean change the sides or the whole washcloth?
I'd change the washcloth.
Okay.
Yeah, it all depends on what's going on with the patient. You know, before I even start her bath, I'm gonna do an assessment to see if I need to do any perineal care or rectal care, because I might have to do that first before I even start with the rest of the bath. And a lot of times that is the issue.
Yeah,
When
they've
you-
been incontinent or they need
Yeah.
to, you know, check if they need to go to the bathroom first before, so that you get that out of the way.
Professor Boss, do you do perineal care if they have a catheter in?
You'll have to
Mhm.
clean around the catheter. Yep, helps prevent infection. And we'll, especially when you guys learn how to put in catheters, we'll talk more about that. Yeah, because you obviously don't want to pull on it. It hurts. Hurts them. Yeah, but it shouldn't. It's ballooned in there, so we'll show you. But that's a great question and super important for males and females. It's also how she did like the different washcloths, or if they weren't, you know, incredibly soiled or something and you didn't have another washcloth and you did a totally different side. When we do Foley insertion for females, that's how we'll clean their perineum before we put in the Foley too. So it's the same process, you know, top to bottom, front to back, sides, and then down the middle with different swabs.
Okay, you ready to start running?
Sure. Sure.
Okay, at this point in time, we've helped our patient turn over, getting ready to do not only the backside, but we're also gonna be changing linen. So I'm gonna be telling my patient, okay, I'm gonna do her back care, long strokes down, clean all that, come in, and then with a new washcloth and stuff, I'm gonna wash the buttocks and I'm gonna go from the back down and clean.
And a perfect spot to check for pressure ulcers, right?
Right.
Because they're completely turned.
Any-
You also can lift this up too if you're worried they're gonna slide out. They shouldn't be like holding onto you. They can hold onto the rail and I'm just kind of supporting this plastic.
Make sure their face isn't in the railing.
Yes, super important.
So we're starting now with the bed changing. If my patient had totally soiled this bed, I would take a washcloth and cleanse the mattress. You notice, you guys, I'm not grabbing my linen and I'm not shaking it to allow everything to go flying through the air.
And make sure you guys practice this, because this isn't something obviously that we want to leave this patient on their side for like 20 minutes while we fumble around trying to change a bed, right? This is when you have a partner with you and I can talk to them and try to make them less uncomfortable. It's just different.
This is the time, like Professor Boss said, if this was a respiratory patient really having trouble breathing, I'd have this bed already done. The bath would have only taken maybe 10 minutes max.
A lot of times those patients or cardiac patients, they may need multiple pillows to sleep. They don't tolerate the bed being flat, like at all. So, have to be super quick.
Okay. Now we're gonna have her roll back over towards me. We're gonna take the pillow out and bring her back over. Here we go. You're gonna have a lump to go over. Then we're gonna have you bend this leg, bring this arm over, and help her. So we have her supported.
Get rid of all the old linens, throw them in, not the ground. I don't have a linen basket. And then hurry and put the rest of the sheets on the bed. And then make sure I flatten down, make sure there are no wrinkles, make sure her gown's not all wrapped up, she's not wrapped in her IV tubing. Make sure her position's okay. Change your pillowcase.
And I would have taken this off over on my table over here. Where's my other pillow?
And this is the bath blanket, so you get rid of this anyways, and you'd have a brand new, sheet and bigger blanket for them. Or some patients just get really hot, so they might want a thinner bath type blanket, but you'd obviously get a new one. So you have
I have a top sheet and a blanket right there.
This might also be a time where you want to use pillows to like support their feet so that their pressures or their heels are floated. Maybe pillows for their arms. If they can't move, if we had to log roll them in bed, they need to be turned every 2 hours anyways. So if they were on, turning to their right, we would have her put some pillows under here to proper to her left so that the pressure's off the right side for a few hours. Any questions about that? It's obviously a lot easier to make a bed without a person in it. So use every opportunity. If you see your patient going to the bathroom, even if they're up ad lib, if they are going to a chair to eat a meal, if they're going to procedure, that's a perfect time to plan your day to change their linens. Really, you shouldn't have to do this unless they are too sick to get up or they physically can't get up.
So you changed your linen before you give them a bath if they go to the bathroom?
If
Yeah.
they're going to the bathroom, they probably should be able to give themselves. You mean like unless they're incontinent or something, or like if they're actually in the bathroom? Yeah, they should, if they're able to get up and go to the bathroom, they should be able to participate, or you can just get them their things ready. Maybe they need a shower chair or they need to, kind of get cleaned up in bed, but they should be able to assist you.
If I take my patient to the bathroom, if they're up to go into the bathroom, then I'm gonna set them up at the sink in the bathroom and do their bath. After they use the restroom and stuff, and I'll say, hey, why don't we just go ahead and take care of your bath while you're right here, and yeah.
And they're clean and their linens are changed and the day is good. And you've already got that huge, task off your plate.
How often will you change the linen?
Supposed to be every day. Or as needed,
Depending on the unit.
Right.
Yeah.
Most of St. Vincent, I feel like it's that I've overfloated to was once a day.
Right. You're always gonna check at all times to see if they need their, that sheet or little pad that I put there. I'm gonna check that each time and change that daily. It might be that their bedspread and stuff and the rest of the sheets are fine, and I won't be changing those.
They may not want you to change their sheet. That's okay, but you
Yeah.
just have to chart that you say okay. Maybe they're going home that day and they don't really want it changed, and you don't want to, spend time doing that. So that's totally fine, but we need to offer it for them.
Okay, the one thing you have to learn how to do is the miter corners, okay? So I always I've got my sheet and the blanket or top cover. I bring it up like a triangle. Then I take underneath here, flip it under, and bring it down. And that's a miter corner, okay? You will find yourself making your bed like this all the time. My husband even makes our bed this way. And I was surprised. He's like, I like the look of that.
Do you guys use a draw sheet?
A draw sheet. Yeah, it just kind of depends on your size. Now, they don't even typically use like the cloth chalks. They use just like the plastic throwaway chalks. So it might just kind of depend what your unit even has available for it is. But it's nice to have a lot of extra things underneath to a degree to help you boost up a patient in bed. You just have like a plastic blue chalks and it's